Let's talk about cutting Medicaid. The House has passed the One Big Beautiful Bill Act, and it's now being reviewed by the Senate. The bill is huge and covers a wide variety of government policies that affect all of us. One of the more controversial parts of the bill are the proposed cuts to Medicaid, which is a joint federal and state program that offers health coverage to millions of low-income Americans. These changes aim to cut spending and will significantly impact people on Medicaid and their healthcare providers. 72 million Americans are on Medicaid. That's 1 in 5 people. 40% of them are children and 10% are elderly. The act proposes 6 policy changes. Number 1, work requirements. Able-bodied adults would be required to complete and document 80 hours per month of work, volunteering, and/or attending school to maintain eligibility for Medicaid, with certain exemptions for those who can't work because of illness, age, or other complicating factors. Number 2, proving eligibility more often. Right now, you only have to prove that you qualify to be on Medicaid once a year, like other insurance, but this bill will increase that to every 6 months. Number 3, changes to healthcare provider taxes. The bill would stop states from creating new taxes on healthcare providers, like hospitals, nursing homes, and clinics, which ultimately shifts more of the costs onto the states, which they may or may not be able to afford. Number 4, stopping efforts to simplify Medicaid enrollment. The bill would stop certain rules designed to streamline enrollment for Medicaid for those who qualify. Number 5, enhanced verification. Medicaid enrollment will require new address and documentation verification to receive benefits. Number 6, cost-sharing requirements. States would be required to pay new cost-sharing charges for people seeking care who are just above the poverty line. This is a hotly debated part of the bill. Proponents of the bill point to the bill's savings, since these changes are projected to save the federal government $700 billion over the next decade and are aimed to make sure no one is receiving benefits that shouldn't. While those opposed to the bill point out that it is also projected that the bill will make 7.6 million Americans lose health care over the next decade. They claim that all the new red tape to receive benefits is just weaponizing bureaucracy against people who are the most in need, and that the bill will result in people who qualify losing coverage simply because they're not able to navigate all the new complexity that this bill adds. They also claim that this will lead to healthcare facilities in rural areas being shut down, as well as nursing homes across the country, since ultimately they receive much of their income through Medicaid. The reality is that the only way to cut Medicaid spending is for less people to receive less health care, and this bill does just that. The bill still needs to be passed by the Senate, and there has been a lot of pushback about the Medicaid cuts from both sides of the aisle, so there is potential for this bill to change. This is part 7 in our What's in the Big Beautiful Bill Act. Subscribe to hear more.